Welcome to the WebMD Health Discovered podcast. I'm Dr. Neha Pathak, WebMD's Chief Physician Editor for Health and Lifestyle Medicine. In today's episode, we're gearing up for cold and flu season, which tends to ramp up in October and November and can last all the way through February. As we move into fall, it's more important than ever to stay informed about the vaccinations that help keep us healthy and protected during the colder months. In this episode, we're diving into some of the most essential fall vaccinations, including updates on the flu shot, the latest COVID-19 boosters, and the growing role of the RSV vaccine. We'll also touch on what to expect if you're planning to get multiple vaccinations and tips for making the vaccination process as smooth as possible. So, first, let me introduce my guest, Dr. Vin Gupta. Dr. Gupta is a practicing pulmonologist who currently serves as an NBC and MSNBC medical correspondent. He's also Chief Medical Officer at Amazon. Welcome to the WebMD Health Discovered podcast, Dr. Gupta.
Oh, well, thanks so much for having me.
I am really excited to dig into our conversation today because I have painfully been trying to make various vaccine appointments for 3 kids of various ages, an 88-year-old father, and it's been just bananas. So, before we jump into all of the questions that we have around our fall vaccines, I'd love to just sort of talk about your own personal health discovery, particularly around communication, because I know that that's something that you're really passionate about. What was that aha moment for you around how to communicate the importance of these different vaccines?
I do think about this a lot because I didn't expect to be playing this role, just like you, communicating to the public or to some segment of the public why it's important to get vaccinated or any number of public health issues that I think we're spending far more time talking about because the public's interested in talking about things that can help them live longer, focusing on health span, not just lifespan. And it does feel like there's been this inflection point over the last few years, post the worst of the pandemic, where there's much more interest in talking about health issues at the national level on news shows where I contribute a lot because there's an appetite for it and to learn. And I do think that's one of the silver linings of the COVID pandemic is the public is much more attuned and their ear is far more to the ground on these issues. My journey here was completely unexpected, which I think is something I talk a lot about to trainees that are interested in health communication, that I didn't strategize or expect any of this. It just it happened by, really organically. I'm a pulmonologist, but I spent a lot of time in the 2010s getting exposure to communications, either through my role in the U.S. Air Force Reserves, where they subsidized medical training. In turn, I got a lot of leadership curriculum and leadership, especially from a military perspective. A lot of that focus, though, is clear communication from a command and control standpoint. And then I did study a lot in the way of public policy. And so I was and remain a clinically active pulmonologist, but with a deep, deep interest in effective communication and leadership skills. And it dovetailed over the last, I'd say, 7 years, where a lot more of the issues we're talking about, whether it's vaccines, whether it's climate and health, whether it's vaping, lung health now is very much public health. And so it's been something that I take very seriously, as I know you do. It's a way that I, as an ICU doctor, believe can have impact well beyond the bedside and hopefully keep people healthy and at home. But I do think now more than ever, accurate health information delivered accessibly, clearly from trusted messengers, you could argue is more important now than ever before.
So let's dig into the prevention piece of it, since fall is getting into full swing and people are wondering about optimal timing for vaccines. So, how do you think about counseling patients around the optimal timing for things like the flu vaccine, COVID vaccines? And before we get to that, what do we even mean by when we say optimal? People are always saying, what does that mean when you say what's the optimal timing?
Yeah, it's something that I just saw an op-ed in the New York Times actually flashed on my phone about 30 minutes ago that talked about this exact issue. And unfortunately, I think because we have access to multivariate sources of information, there's a lot out there, and more information doesn't necessarily mean better or clearer guidance for patients. I think it's causing a lot of confusion. To be very clear, when should you get the vaccine for a respiratory virus like COVID or flu? to provide you the strongest amount of protection against severe illness as the weather gets colder. And we know that there is a period of vulnerability where we're all vulnerable, but especially for medically higher risk because of age or a pre-existing condition. Between the months of, say, November and the end of February, that 4-month window, it's when we want to maximize your protection. And so, what's the optimal window to get vaccinated with these annual boosters so that between November and the end of February, just to try to guardrail it, you are durably protected with maximum protection? And that goes back to what we now know about these vaccines that yes, annual boosts make sense, but turns out that annual boosts don't necessarily give you the same level of protection for a 12-month period, that you have strong protection about 2 weeks after you get one of these booster shots for flu or COVID. And then that peak protection lasts for after that 2-week acclimatization phase where your body is responding, your immune system is responding to the vaccine. You have that peak protection that really starts to attenuate about 4 months after. And so you have that 4, maybe up to 6-month window of strong to very strong protection from the vaccine against severe illness. And then that's when you start to see a tail effect really go underway. So for the individual that gets vaccinated, I always recommend end of September to the middle of October for your COVID and your flu shots. You can get them at the same time. I actually got them in the same arm about 5 days ago now. And I had some soreness in that arm. I was a little tired the next day. By middle of the next day, I was back to myself. And I did it in that sort of that end of September to mid-October window because I really want to enter the month of November with optimal or the strongest protection possible, and to have that protection last about 4 to 6 months. So to get me through the end of February into the early spring. So March, April, you're still good because we know flu season especially can lag and seems to be longer and longer every single year. But that's what I think about when I think about optimal protection for my patients. That might be, anybody. It doesn't necessarily have to be somebody with underlying lung disease, but anybody. I really think about that end of September to middle of October window to get your COVID and your flu shots. That's the window that's ideal. I think what's happened and what we've seen, Dr. Pothrick, is because we have multivariate sources of information. There's some people that I know got vaccinated in August or in September with a prior version of the booster, and that's okay, but that's not optimal.
And when you're talking about that, you're talking about the COVID vaccine that they got boosted in August.
That's right. So when we talk about optimal, we're really talking about how do we maximize protection with the most updated shots for that November to end of February, early March period. And that's where I would say make sure you wait, as now we have available to us the updated versions of the COVID and the flu booster shots for this respiratory viral season, and to target end of September to mid-October.
Okay, that's really helpful because I definitely had a lot of patients asking me about the COVID booster during the summer wave. And now they're sort of following up and saying, well, okay, now I had it in August. So do I wait 4 months or what do I need to do at this point? Or I think I might have had COVID. So, yeah, clarity around that would be really helpful too.
We don't have definitive data on, well, if you had COVID in June, here's when you should definitely get the booster shot. But based on the best available data, the recommendation is to wait between 90 and 120 days, so 3 to 4 months after you've recovered from your bout of COVID to then get that season's booster shot. And so if you're somebody that's listening and you had that about a COVID in June, if you're mapping out about 3 months from that, I'd say between 3 and 4 months in that window, now's a good time to go ahead and get your booster shot. And what's the reason? The idea is give your immune system about a 90-day break at least so that it can properly respond to the vaccine itself. It's come down from its high at battling the infection, and now it's had a chance to recover and respond to the booster shot. And so that 90-day guidance at least is recommended. It's what I counsel my patients to do. It's what I counsel the public to do in my platforms. And I think it makes sense. And something similar, should you have had flu, for example, I think there's less flu going around in the summer than COVID. But if that happened randomly to be new, to wait that 3-month period as well. If you're somebody that had gotten the old booster shot, so the 23 version, but say in August, because you saw a lot of people around you having COVID, I would have a conversation with your medical provider, frankly, to make sure that we understand, especially if you're medically higher risk, maybe you have an immunocompromising condition or take powerful medications that suppress your immune system. Perhaps you're an individual that should actually get a second vaccine this season, the updated version a few months later. But I suspect that's going to apply to a small subsegment of viewers today. And so I would caution anybody, if they've already gotten the booster shot and it was the old shot in August, to hold off on yet another shot. Have a conversation with your medical provider. If you're in that exception group that is on a powerful immunosuppressive medication, we have a serious underlying condition like requiring dialysis, maybe you do actually need that updated shot right about now into the end of the year, but have a conversation with your medical provider.
That's great advice. And I kind of want to get into a little bit around messaging for the public when we're talking about what these vaccines can and can't do. So, can you talk a little bit about what we're talking about when we say effectiveness of these vaccines and what we're hoping that these vaccines do? Not that you won't have a case at all or you won't be infected at all.
This is so critical, Dr. Potter, for lay understanding and to reset expectations and, in some cases, to rebuild trust. I think what we missed, and I noticed this firsthand as a pulmonologist throughout the pandemic, we were overstating or oversetting expectations for the public on what these vaccines could and could not do based on our prior knowledge on, say, the flu vaccine. And in every single case from now, and I would suspect well into the future, we should make sure we're clear with the public on what to expect from these vaccines because now there's forces out there that are looking to discredit vaccines at every turn. So we have to be very clear on what success looks like and what success has long looked like with these vaccines for respiratory viruses. Again, using flu as a predicate is the vaccines are designed to keep you out of an intensive care unit with severe pneumonia. Full stop. They are not meant to prevent infection. If we had visuals and a chalkboard, maybe we could map this out. But really, what ends up happening is the vaccines mobilize an army of immune cells in your body that are sort of backward deployed in your body. They're deployed in areas throughout your lungs to fight off the severe pneumonia, but they're not as forward deployed in your throat and in your nostrils. And so it is very much the case that you could get the COVID shot or this season, the annual flu shot, be protected because you have all these reinforcements of T cells and antibodies in your lungs. They're backward deployed, but you have less of those as we go up the respiratory tract into our oropharynx, into our nostrils. You have less of them, and it's almost your front line where you breathe in some of these viruses. So it's very common and it should not be unexpected where you could be fully protected with all your booster shots and still come down with a runny nose from COVID or flu, sore throat, upper respiratory symptoms, because that's not where our immune cells really double down. It's really to protect against pneumonia. And that's what these vaccines do really well. They prevent severe illness. And that's what they've always done very well. In the future, when we talk about the RSV vaccine, which, by the way, if you're 60 years of age and older, the one shot vaccine, a one time vaccine, something that you should be thinking about. I would stagger it by 2 weeks. You can get COVID flu at the same time, then 2 weeks later to get the RSV vaccine. But by the way, RSV vaccine is not going to protect you from infection and a positive test and maybe sniffles from RSV, but it will protect you from severe pneumonia. And that needs to be how we talk about it. And I think we should even go so far as to actually explain in simpler terms the immune system response. To me, it makes a lot of sense. And then it can help make the skeptical individual be like, well, how is it possible that I still have a positive test, sniffles, but you're saying the vaccine works? I think now we've gotten to the point, Dr. Pathak, where we actually have to explain some of this to rebuild trust.
Dr. Gupta, I have to say I love the imagery and I do wish that we had visuals of what you just described. As a VA primary care doctor, I really thoroughly enjoyed the military analogies, but I think that, yeah, that's absolutely, I think it's so helpful as well. In some of my counseling, when I talk about the flu shot, it's not necessarily even just about the flu symptoms. So, as you described, the upper respiratory symptoms, etc. If you have heart disease, if you have diabetes, because you're so well protected from the intense inflammatory response of fighting off a pneumonia or potentially having a pneumonia that can also impact you because you have heart disease or diabetes. You're protecting yourself from those conditions as well.
Oh, absolutely. I think that's what people don't realize is that there's a cascading effect where if you're fighting off one severe illness, to your point, maybe you're battling severe flu and you didn't get vaccinated. Not only are you putting at risk or potentially disturbing the equilibrium with your other chronic diseases if you're battling other chronic diseases, but you're also, and I think this is something we don't talk about it a lot, but you're opening yourself up and making yourself susceptible to secondary infection. There's many people that I sadly have cared for with COVID that landed them in an ICU who ended up having a secondary bacterial pneumonia because the immune system's so busy fighting off one thing, doesn't have enough reinforcements to fight off the next thing. And then often that's a mortal event. And so we really need to help people understand how the vaccine works because again, there's a lot of malevolent forces out there mischaracterizing what the vaccine does and does not do, and is using a misunderstanding of effectiveness to then question purpose. And that's what us as highly credentialed providers need to push back in an accessible but scientific way. And I think we do it in this way. It's actually gonna disarm those that are looking to misinform.
And then I'd love to also honor folks that do have some side effects from the vaccination. What are some of those side effects that you can expect so that, we should, as health professionals, honor those symptoms and acknowledge that, yes, these types of things can happen?
Absolutely. Anticipatory guidance is critical. I'll give you my example. I got COVID and flu in my right deltoid, at night after coming off an ICU shift, and I knew I was off the next day. I had childcare, so I had all the chess pieces in place. So I just relax. And I'm glad I did that because it hit me at 9 a.m. about 14 hours later, super tired, pretty sore, sometimes feeling a little chilly, and ended up needing to just be in bed. I took some over the counter ibuprofen and hydrated. And by the middle of the day, I was feeling totally fine. But I think people should expect fatigue, maybe even feeling flu like symptoms like chilliness and soreness. Those are overwhelmingly what you're going to experience, if anything. And it's okay. And it's going to resolve. Might take somebody maybe a little longer, maybe a full day, maybe it might take 48 hours. And I recognize that that's hard on a lot of people who have jobs, who may not have childcare, who might have to go to work the next morning. And so there's a lot of barriers here that I love that you framed it as honoring, because we do need to honor that. And anticipatory guidance is important. I'd rather people figure out to the best of their ability in situations how they can time a 24-hour period of rest and recovery to the maximal extent possible to ultimately do something that's going to save them a lot of time down the road, which is, sickness. Averting sickness in the first place is going to cost way more in terms of time than dealing with the side effects that I think are quite manageable in the overwhelming number of cases. That's going to require far less time. So I think if we frame it that way, anticipatory guidance, but what you're also averting potentially that could be far more costly time wise, that's helpful.
So we often hear patients say, well, I've got a little bit of a cold, or my child has a slight fever. Their symptoms are very typical for a cold. What are some of the situations in which you would say, let's go ahead with the vaccine? You've taken the time, you've set up all your chess pieces, versus, no, we really should at this moment hold off and plan for another time.
My wife's a pediatrician, and we talk about this. I would recommend that short of febrile illness, where your child or you as an adult are actively fevering with a temperature of 101.3 degrees or higher, or maybe there's something truly going on here that we want to make space for from a recovery standpoint. If you're having upper respiratory symptoms, don't have a fever, then it's okay. You should still push ahead if you're planning on getting the vaccine. But with febrile illness or real fever, that's where I would say pause, let your body recover, whatever your immune system is fighting off, let that process happen. And let's see if we can reassess in 48 to 72 hours. In a world where it's hard to get black and white guidance when it comes to battling a sickness, should you get the vaccine, I usually gate it to febrile illness or not.
I'm so thankful for your time. I'd like to yield final 2 minutes to you. If you have final thoughts and bite sized action items for our audience listening today to protect themselves as we head into fall and winter.
What I'd say more than anything else, especially for those that have a underlying chronic disease, might be or 60 years of age and older, make sure you have a care plan in place with your medical provider. We've talked a lot now about vaccines, about proactive ways you can stay healthy. Another thing that you can do is make sure that if you unfortunately do test positive for COVID-19 or flu or RSV, that you have a plan in place with your provider to get ready access to treatment. And so, what does that mean? That means going to covidtests.gov to get your free allocation of COVID tests. You can go there right now and you'll get some tests shipped to your direct to doorstep. Because if you test positive for COVID, there's treatment that's available, but it's most beneficial if taken rapidly. Similar with flu. If you have flu-like symptoms, maybe it's COVID, maybe it's flu, maybe it's none of the above. Getting access to your medical provider to get a test, especially because you're probably going to have to go into a clinic to get a flu test, that's important because treatment for flu, time also matters. So make sure, especially if you're medically higher risk because of your underlying condition or because of being 60 years of age and older, that you have a care plan in place as we enter the colder months.
Thank you so much for being with us today, Dr. Gupta. We've talked with Dr. Vin Gupta about all things fall vaccination, from flu and COVID, even touching on the RSV vaccine. Dr. Gupta really helped us manage our expectations about what it means to be fully protected when we get one of these vaccinations. And he also helped us understand that being vaccinated and protected doesn't necessarily mean we might not test positive and have symptoms. It's all about turning these infections from wild and potentially life threatening to mild and controllable. To find out more information about Dr. Vin Gupta, visit vinguptamd.com, and we'll have the link in our show notes. Thank you so much for listening. Please take a moment to follow, rate, and review this podcast on your favorite listening platform. If you'd like to send me an email about topics you're interested in or questions for future guests, please send me a note at webmdpodcast@webmd.net. This is Dr. Neha Pathak for the WebMD Health Discovered podcast.